So rheumatoid arthritis is one of the most common autoimmune diseases worldwide. Approximately 1 to 1.5% of all Americans ultimately get diagnosed with rheumatoid arthritis. So it's an autoimmune disease in which the body attacks its own joints and the tissues surrounding the joints. And ultimately, this inflammation from the body attacking the joints can damage the joints, causing disfigurement, severe pain, and limitations in the ability of an individual to be able to function both in their day-to-day life and at their work. So rheumatoid arthritis is a systemic disease in which there's inflammation that primarily affects the joints, and so it can affect the small joints of the hands and the wrists and cause a lot of pain and stiffness, including in the mornings. But because it's a systemic disease, it can also affect other parts of the body, including the lungs, the eyes, causing inflammation in those joints as well. So as rheumatologists, we have to think about a person holistically and think about how the inflammation can affect any part of their body. So rheumatoid arthritis can start sort of slowly, with joints becoming a little bit more painful over time. Typically, people start to feel more than an hour of morning stiffness where they get out of bed. It's just really hard to move their joints. They're clenching, a hot shower helps. And over time, that stiffness and pain can last throughout the day. So if you start to notice these symptoms, talk with your primary care doctor. It might be appropriate for you to start out with getting a routine set of labs, including inflammation markers. And if those tests start to look abnormal and your primary care doctor is concerned, it might be a good idea for you to see a rheumatologist. We're always talking with other rheumatologists across the Pacific Northwest to get a sense of how long are our patients waiting to get appropriate treatment so that they're not constantly in pain and suffering before they come to see us. Unfortunately, the situation is pretty dire across Washington State and in the Pacific Northwest in general. There are no rheumatologists or full-time rheumatologists on the Olympic Peninsula. Patients often wait 1 year to see a rheumatologist in the Tri-Cities. The wait time can be over 6 months in Yakima. There are only 6 rheumatologists in Alaska, all of whom are in Anchorage, as well as one who works with Alaskan natives. And so we see a ton of patients who are coming down from Alaska, including from Skagway, Juneau, Sitka, and other parts of the state, just because it's much easier for them to come down to Virginia Mason as opposed to waiting to go to Anchorage or other sites. I have patients who drive 12 hours from Boise or longer from Missoula, Montana, and so this is a huge issue across the Pacific Northwest. At Virginia Mason Rheumatology, we are so proud of what we're able to do to help patients get diagnosed with autoimmune disease as soon as possible in the Pacific Northwest.